and Instagram. And we are now live on both platforms. So welcome again to Wellness Wednesdays with Dr. Wells. I am Dr. Latoya Wells, family nurse practitioner, doctor of nursing practice, and owner of Wells Legacy Health and Wellness. We're here again for another edition of Wellness Wednesdays. I do have an amazing friend, Kemille Bell. I'll give her a moment to tell about herself in just a moment. But I'm just grateful that you're here each and every Wednesday. You guys choose to show up for me and for Wellness Wednesdays, and I'm just grateful. So I'm going to give Kemille, my friend and colleague, I consider her to be a sister, that joined. We chose each other,
Yes,
I guess.
Yes, we did.
And I'm just grateful for her. So I'll give her a moment to introduce herself.
Well, I just want to thank you so much for inviting me onto this platform.
Likewise.
And I have been so proud to see you and your presentation on with Wellness Wednesdays. And I think that it's a great benefit to the community. So I commend you for continuing to do it and the work that you're doing, because it takes work to do what she's doing. So I commend you for bringing about, healthcare professionals and allowing, the community to be able to be educated. So Thank you for the platform. My name is Kemille Bell. I'm a family nurse practitioner. And I have been a family nurse practitioner for going on 13 years now. My background is a bit diverse. I started in primary care, and then I transitioned into hospital. I worked at a large hospital system for 5 years, and I did inpatient glycemic management. While I was there, I became board certified in advanced diabetes management and focused on inpatient care of people that had the gamut of issues as far as blood sugar issues. So insulin drips, type 1, type 2 diabetics, diabetes, but also complicated by renal disease, the gamut of complications. And then I went into acute care, I went into geriatrics, and then also started working with dialysis patients in various clinics. So I also now have my own practice.
Yay.
Pinnacle Family and Diabetes Management Center. It's primary care, but it has a strong focus on diabetes management as well because of my background. So that's a little bit about me.
All righty. So welcome to Wellness Wednesdays, Kemille.
Thank you. Thank you.
So I just want to, again, thank you for being here. I told Kemille, I say, I'm going to pull on you. I just didn't know when it was going to be. And as I began to prepare for our November topic, I was like, oh, got her. I got her. And I asked, and she answered the call. And I'm just grateful for you taking time to come, taking time away from your family, your kids, to come and just sit and talk with us for a little bit. Right. So as you guys know, this month is Diabetes Awareness Month. Each month I like to talk about a different topic. November is also Men's Health Month. There's a bunch of different healthcare conditions that are highlighted every month. So tonight, what I want to do is tie the two together. I want to marry the two together, diabetes and men, right? Because typically we talk about women's health. We just finished October talking about breast cancer awareness. And so tonight we're going to talk a little bit about diabetes in the men. Last week we did an overview of what diabetes was, a different type of diabetes, different, who's at risk, signs and symptoms, things of that nature. So Kemille, you're an expert on this. She's board certified, guys. That means she studied, she took a certification test, and she has the experience to back it, right? So she's walked it, talked it, lived it. And so if anybody is an expert, it's going to be Kemille. So let's talk a little bit about it. So let's talk about diabetes. Last week we talked about what diabetes was. If you had to explain to somebody in a short summary what diabetes is, what would you say?
Diabetes essentially is broken up into a process where your body is not able to utilize glucose or sugar in a way that it normally should. So normally a person, when we eat, we use those calories and it turns into sugar. Certain types of food turn into sugar. And what happens is our body, in response to that, produces insulin in order to pull that sugar or energy into the cells, and we burn it off. But with someone with diabetes, either they are not making enough insulin, or the body has a resistance to it, an absorption issue, or they have type 1 diabetes where they don't make any insulin. So they have to use exogenous insulin or insulin, that they buy. So,
okay. And so in your experience with diabetes, I know we see more women, right? Women are more likely to come to the doctors versus men. So men, if you haven't gone to your doctor and got your physical exam, this is my plug right now. Go and get your physical exam. Yeah. But when we're talking about diabetes and men, talk to me about that. What is your experience with men and diabetes?
My experience with men and diabetes, of course, it depends on the background of the patient. But my experience has been that oftentimes men, because they put off screening for themselves, by the time they're diagnosed with diabetes, they already have some form of complications. Okay. So although they have some of the same issues that women have, it's a little bit more heightened by the time they present. So in men that have diabetes, they can have additional issues that are related to erectile dysfunction, because of the fact that they have heightened sugar. They have urinary issues. Of course, with any kind of diabetes, there's a risk for kidney disease. Correct. And then also a heightened risk for cardiovascular disease, heart attacks and strokes. Correct. So those are some of the things that I've seen with men, especially the sexual dysfunction. And so we do have to start, kind of discussing diabetes, heightened blood sugars, and how that affects the vasculature, how it affects your capillaries and your vessels and circulation in general, which can affect, your ability to perform or have, erections or have, sexual health issues. Correct. So that is normally a lot of the concerns that I hear from men that, have diabetes, or perhaps they don't, but this is the symptom that prompts them Correct. To be evaluated.
Correct. So last week, and that's important because last week we talked about the impact of the high glucose level, the high sugar levels in the body, and how it impacts the vessels. And how I explain it to my patients a lot is I have this straw, right? I'm going to take my straw out of my drink. And you have this, let's pretend this is a grape. This small blood vessel, that sugar molecule is so big and it's trying to force its way through this small blood vessel, and it causes damage. And so, as you just mentioned, like for men, they have issues that women don't necessarily have. And many times that's the reason why they come in. The plumbing's not working. I had one guy tell me, the plumbing's not working. We need to figure it out. And so the first thing we did was do some blood work. Well, we did a A1C in the office, and it came back extremely high. And when I start to ask questions like, have you been thirsty? Or have you been peeing a lot, urinating a lot? Have you been really hungry? Yeah. All those answers were yes. Like, I can't stop drinking. I'm just thirsty all the time, and I'm urinating a lot, and I'm really hungry. Well, those are the key signs and symptoms of diabetes. Yes. And people, and we're not just let me just say this. Not all men don't go to the doctor. Right. We don't want to classify everybody under the same umbrella.
Everyone has a different background. And
correct. So men, we're not beating you up tonight, but if you have not gone to get your physical exam and you have not had your A1C checked or your blood drawn, then we are beating you up tonight. Okay. So if the shoe fits, wear it. Talk to me later. I'll help, fix you up later. Right. But those are the classic signs of diabetes. And in nursing school, we learned the correct terms for those. What are those? What is that called? the oliguria,
the oliguria, polyuria,
polyphagia,
yes.
right?
Mm-hmm.
And so your extreme thirst, constant increased urination and frequent being hungry a lot.
Yes.
And so with men, as we just talked about, the number one reason they come is when something's going on, in down yonder, as one man said, one patient told me. So I'm going on down yonder. We need to fix it. Well, in order to fix that, we got to get to the bottom of why that's an issue.
Mm-hmm.
And so then it opens up a whole nother level of conversation, testing, treatment. And, then I've had a patient get upset with me. I just came here for one reason. And now we're dealing with all of this. Well, all of this is what brought you here.
Because this is just the beginning.
Correct.
Right? And if it's gotten to this point already, then we really need to address this before you have further complications.
Correct.
And just also to piggyback off of what we're discussing as far as erectile dysfunction, risk factors, right, for diabetes are, obesity, increased weight, things like that, which also can increase your risk factors for decreased testosterone.
Correct.
So those are risk factors. So if you have a decreased testosterone, that also contributes to reduced sexual function and, complications in that area as well.
Right.
So it's also, identifying that the person has blood sugar issues, but also then, treating things that can be modified, which is, weight loss and exercise and, dietary modifications as well too. So in men, that I would think that's specific to men too. Of course, testosterone is higher in men. So that's a unique complication, I think. Women who have they can have increased testosterone as well because of high insulin levels too, but they are affected differently.
Correct.
It affects ovulation. It affects, menstrual cycle. Whereas with men, you're going to see more, body fat.
Yeah.
You're going to see gynecomastia, enlargement of the chest tissue, or, man breast, as people would say. And then also, sexual dysfunction. So these are things that I think are not directly, we hear about diabetes a lot, but I think in men, it's not as clearly discussed how diabetes directly affects erectile dysfunction and sexual function.
Correct.
So, yeah.
Correct. And it's important that we highlight the differences in the two. A disease process will impact a man sometimes differently than a woman, just because of their anatomy and their makeup. And so when we go back to diet and exercise, I was reading something on social media earlier today. This guy had a picture of himself a couple years ago, and he had $238.9, 238.9 with a dollar sign, like it was $238.90. That was his weight. And he had screenshots of the conversation that he was having with somebody online. And his initial post, he said, I don't know why people spend so much time going to the gym. Nobody got time to be in the gym for 12 hours. I can eat what I want as long as I use portion control and moderation. I don't have to work out. Well, now you see him much healthier. He's lost a ton of weight. I believe this gentleman lost over 100 pounds. And in the post, he talks about how he had diabetes, he had hypertension, he dealt with erectile dysfunction. And once he began to take his health seriously, work out, eat right, go and get the proper care and exams and screenings, his health changed.
Yeah.
And I think a lot of time it's all about the mindset and how we think about things.
Yes.
And many times if we could just get people or patients to see the impact of where you are right now
Mm-hmm.
versus making that shift in your mind and in your thinking,
Yes.
it can help you in the long run.
Yes. Yes, absolutely. Absolutely. You know, because we always teach, or we should be teaching in
Mhm.
primary care. It's not about just medication.
Correct.
Step one in treatment is always lifestyle modification,
Correct.
regardless of the disease process, especially when you're talking about chronic disease management and if you're on medication, you don't want to be treating a lifestyle
Right.
with medication
Right.
versus adjusting the lifestyle and then assessing and seeing
Correct.
if you need to treat medication, because that's not enough. Because what happens is when you have a chronic disease such as diabetes, it can either stay stable or it can worsen over time
Yes.
and lead to complications.
Yes.
So let's say you have diabetes and your doctor decides to put you on insulin or, you know, some kind of oral agents. If you're continuing to have a poor diet, if you're living a sedentary lifestyle, if you have decided that you're going to take, you know, no ownership for that, what's going to happen is your doctor's going to, you know, keep monitoring and saying, oh, this is not enough. This is not enough. Let's add more medication on.
Yes.
And then there's no improvement. So everything starts with lifestyle modification.
It does.
Yeah.
And if you're someone who's watching or live or you're watching later,
Mhm.
and your healthcare provider did not start the conversation off with lifestyle modification, I would say you either go back and revisit that conversation with that provider,
Yes.
or you make a decision on whether or not that individual is the right person for you. Because now there are some cases where people
It's
come in
severe and it needs to
and
be
we
treated.
have to start them
Yes.
on medication right away,
Yes,
right?
absolutely.
However, we run the blood work, we see, okay, your levels are showing that you're at pre-diabetic.
Mhm.
This gives us some wiggle room to do some things, lifestyle modifications, to try and reverse things or change things.
Right, right, absolutely.
And as you mentioned, diabetes is a progressive disorder,
Yes, it is.
progressive disease. So over time, if we're not doing the things that we know that work, the lifestyle modifications and medication, if that's the case, but we want to start with the lifestyle modifications first. It can get worse.
Yes, yes, absolutely.
And that's over time.
Yes, yes.
So let's talk about the diabetes and the pancreas and how that works over time.
Okay. So basically, your pancreas is an organ that produces insulin. You have a certain amount of cells that produce insulin. And so there's different stages. When we talk about diabetes, that's a little bit later in the game, actually. Prior to that, what people may have is a certain level of insulin resistance that starts. So that insulin resistance, it can be genetic or it can be related to extra weight, you know, being overweight. And so what happens is your body, in order to keep your blood sugar control, tells your pancreas, I need to produce more insulin to be able to keep my blood sugar in check, right? And then what happens is over time of this process of basically your body negotiating and saying, okay, that's a good word, right? Negotiating and saying, okay, you know, you're not playing the game with me, so let me just overproduce and work a little bit harder. Those cells start to wear down and they're not as effective. So then what happens is you're producing less insulin or you're more resistant. And then what happens, your blood sugar starts to raise. We talk about hemoglobin A1C, which is a measurement of the sugars on your red blood cells for the last 3 months. So a provider that you may see may start measuring that and seeing, hey, you know, your blood sugar, your A1C is now 6 or 6.5, right? And so what's happened is your body is, you know, said, we worked overtime.
Right.
And we don't have, we've worn out these cells. We don't have anything else to give, right? And so that's when you may go into a position where you have to get aggressive with lifestyle modification, or you may have to start on some kind of medication because now your body is not able to produce enough insulin to keep your blood sugars controlled. So that's kind of the triad, and that's why lifestyle modification is so important. And so then when we're piggybacking that back to men, what you'll see is maybe in those beginning stages, you've got this extra insulin, you may be gaining a little bit more weight. You can't lose weight, or your appetite is a little bit more increased, or you tend to be thirsty and you're thinking, oh, it's because I'm working harder, or I just have a good appetite. And then what happens is over time it becomes more difficult to keep your blood sugar controlled, and that's when you're then dependent on medication. So
right. So as a provider working with many patients with diabetes, and you've been inpatient with them, so you've seen them at their critical levels, and you've seen them when they're stable. The reversal of diabetes. Some people say once a diabetic, always a diabetic. What is your thought on that?
My personal stance on it is that is actually true. You are a diabetic, but you are managed. You are managed with, lifestyle modification. I do see, patients who have been diagnosed with diabetes and they have, done the work to either lose weight or change their diet or become more active, because those things do help, especially activity. What is that doing? It's helping you to burn that extra glucose. It's helping your body to utilize that, because that's energy that you are burning off. So I do see people that are able to reduce their A1Cs with lifestyle modification or weight loss, and their A1Cs then trend down and are in the normal range. But that does not mean that they're diabetic, that they're not diabetic. They're just managing it with lifestyle modification.
So I hear that a lot. Oh, well, I was told that I was diabetic, but no longer am I diabetic. No, it's just managed.
Right.
How often have you seen, oh, well, they say I'm just a little bit diabetic?
I hear that quite a bit, or they're just watching my sugars. And so if you hear that from a provider, you should ask them, what does that mean? Correct. Can you specifically tell me what you're watching? Are there specific numbers that you are measuring? Can you provide me lab work and explain that to me so that I can also be an active partner in my healthcare? Because we know that, providers are busy, and sometimes, it depends on the provider. They may assume that you understand, what they're explaining to you, or they may not have the opportunity or think they have the opportunity to go in detail. Correct. So it's really important that you're an active participant in your health, because I do see that quite a bit especially in the, geriatric population. I would see patients that I would do urine testing and there was a lot of sugar in their urine, or I would do a hemoglobin A1C at the home and it was elevated, and I would bring it to their attention and they'd say, oh, the doctor just told me they were watching my sugar. And I would say, have you ever been has it been ever notated to you that you were diabetic? No, but it's all in their medical record. It is that they are in fact diabetic. So it's really important that we take ownership and we ask questions.
Correct. So being an advocate for yourself as a patient is important, and asking the questions. Like, you have hired this person, you are paying this provider. When you come to see us, you've paid us for our time.
Right.
It is our job to make sure that you leave that visit empowered and knowledge, have the knowledge that you need about what's going on with your health, that you understand the labs. For me, I like to get the labs in a pen and kind of draw it right on there, and this is what this means. So I make sure when my patients know what is going on with them. Ask the questions, as Kemille said. I had something in my head, it just kind of left, but ask the questions, the numbers.
Yes.
Right? Know the numbers. So tell us a little bit about the numbers. What is normal A1C? What's a normal A1C?
So a normal A1C would be less than 5.6.
Okay.
That would be a normal A1C.
Okay.
If you have elevation like 5.8 or 6, that's considered in the pre-diabetes range. So it's telling you, hey, there's something going on here. Your body is not producing insulin
Correct.
quite, or it's not utilizing it quite like it should. And then when you have a hemoglobin A1C of 6.5 or greater, then you would be considered diabetic. So those are the numbers.
Okay.
Mm-hmm.
So living with diabetes, if we were talking to an individual who came to see either myself or you, and we diagnosed them with diabetes based on their lab work, or we did a urine dipstick and that caused us to do more testing, and we have a definitive diagnosis of diabetes, what are some things that they can do to live, make it easier to live with diabetes? Sometimes people hear things and they're like, oh, it's doom and gloom. I got diabetes. I can't eat this. I can't eat that. That's not the case.
That's not the case. And I, as a provider, I mean, I understand that getting a diagnosis of diabetes is it feels devastating. We're humans, right? But it doesn't mean, like you said, that it's doom or gloom. There are many people that have diabetes for years and are well managed, and everyone is different in where they're diagnosed. Some people are diagnosed earlier on. They know they have a family history. They've been getting primary care. And so it's a little bit easier managed. And others, they were diagnosed later on in the disease process. So it's a little bit more complicated. But what I would say as far as management is, when you get that diagnosis, just saying, you know what, I'm going to take ownership and I'm going to do what I need to do to be able to manage it from my standpoint. So I'm going to be mindful. You're still we have a life to live. So there are times where you may have a slice of cake, but you're not having a large slice of cake.
Correct.
And you're not having a slice of cake every day. Correct. And you're not going back for seconds. Correct. Right? And you do recognize that, you have to be more vigilant later on. Right? So it's all about modification, primarily having a diet that's, lean protein, plenty of veggies, increasing your water intake, reducing simple calories, simple sugars like sodas and candy, and even fruits that are high in sugar, and focusing on fruits that are more water based and have more complex, fiber, such as like apples, and are not broken down so easily and turned into sugar in the body. So it's all about learning what foods are best for diabetics and increasing your activity. And then, following up with your primary care doctor, making sure where your numbers lie, knowing what the plan is. If my A1C is in this range, what is the plan? Am I continuing lifestyle modification? Or are we, considering that I have to start a medication, and if you don't want to start a medication, what do I need to do?
Correct.
What is the time span that you were allowing me to have for reassessment so that we as a team can determine when medication is needed? So it's all about being transparent, taking ownership, and being an active participant in your health.
I agree with that. Time-based goals, right?
Yes.
We can set a goal, but we want it to be time-based, because we can't allow someone to go from pre-diabetic to diabetic, and now we're still doing lifestyle modifications. And what we were doing for the past 3 to 6 months isn't working. So we have to have some realistic goals. Would you recommend an individual who may have pre-diabetes and they're working on the lifestyle modifications to meet with a dietitian at any point?
Yes, absolutely. Meeting with a dietitian is excellent because they're able to go into detail. They have the time and the knowledge base to go into more detail about the specific foods that are higher sugar based or may increase your blood sugars. So when you go with a dietitian, they can tell you how to do a plate method. Correct. Which is how you would set up your meals. And that helps you with lifestyle modification. They're able to educate you on, different fluids and, different type of drinks that you may not know have a large amount label reading. Correct. There's a lot of, if you're not trained, you may think that something is healthy and it's actually not, right?
Right.
So for instance, a lot of these like energy drinks
Uh-huh.
or hydration drinks, you would be surprised, like
How much
Gatorade,
sugar
how
is in
much
there?
sugar and salt is in that. So
I'm a
they teach,
Gatorade junkie, but I'm
yes,
also not diabetic.
right, right. So what works for one may not work
Right,
for another.
right.
So it really is beneficial to speak
Hmm.
with a dietitian, because they're able to break that down to you in layman terms so that you can take ownership. You
Yeah.
know how to read your labels. If I'm on vacation and these are my options,
Yeah,
this is how I'm going to build my plate.
correct.
So very
There,
beneficial.
thank you. There's a lot of resources that are available, and I think some individuals get very overwhelmed when they hear the diagnosis of the word diabetes, but it's not the end all be all. There's resources, there's help, there's support for you, but it all starts with getting that initial physical exam. Without the physical exam, we can't determine if there's something wrong or if everything's perfect.
Right.
So it is important that individuals, one, get their physical exam, that they follow up on the results, they get the blood work done. How many times have we given someone a lab slip to go get blood work done and it's
Right.
never done?
Right.
And they come back or they don't come back because they didn't get the blood work done.
Yeah.
And so it's so important. But as we begin to close, is there anything else that you want to highlight tonight?
I really want to highlight just my personal experience.
Yeah.
I have a cousin who had gestational diabetes.
Oh,
And because of a lack of primary care, is facing complications associated with that.
oh,
Is currently blind.
oh no.
So it really hits home the importance of primary care, the importance of knowledge, knowing your numbers,
Right.
the expectation that you and your primary care doctor have with each other as a team, and just taking ownership. So I just wanted to highlight that as providers, our goal is to keep you as healthy as possible. And it's a benefit that we have the primary care that we have now, because that didn't always exist.
Right.
So, taking ownership in your health can really prevent you from a lot of complications down the road. So I know it's scary.
It is.
I know it takes some time, but it will, if you do the work, you can really, build the possibility of having positive outcomes. So
yeah, you mentioned, thank you for sharing. I'm sorry
You're
to hear about
welcome.
your cousin. That's unfortunate and it's sad because it doesn't have to be that way, right?
No, it doesn't have to be
With
that
all the
way.
resources that are available, to hear that somebody is facing blindness because of gestational diabetes is just sad. My oldest daughter, developed gestational diabetes with her second child. And I was talking to her about the importance of following up even after she has the baby, because she's at a higher risk for developing diabetes later down the road. Not saying that she will necessarily,
Right.
but there is a risk
It's
there.
a higher risk.
And
Yes.
so knowing, one, your family history, we talk about that, knowing your condition at any given stage of life, whether you're a woman and you're pregnant and you've developed gestational diabetes, but just knowing your baseline of your health overall is important.
Yes, absolutely.
And that's why I always go back to that physical exam. Have you had your physical exam today?
Yes.
Right? Just like you get up in the morning, you go brush your teeth. You need to be scheduling, all the important exams that we should be having. But I just want to say, as we close tonight, Kemille, thank you so much.
You're welcome. It's been a pleasure.
I may have you back.
I've enjoyed myself. I was so nervous, but you have just been such a gracious host. I really enjoyed it.
Thank you. I said, listen, I'm nervous. I don't know why. I'm nervous, but I knew you were going to be great, and I knew you had a wealth of information. And look, we didn't even touch the surface of all that can be discussed with diabetes. But I like to try and keep it short here. I don't want to bombard you with information overload. But if you had one thing to leave with the individuals that are watching, what would that be?
One thing that I would lead with is you matter. Your health matters. And make sure you prioritize that.
Right.
Yeah.
You matter, your health matters, and you and your health are both the priority.
Yes.
I think we need to hear that.
Especially
right?
men.
Yes.
Especially men.
Yes.
You know, we need our mom, our dads,
Yeah.
we need our grandpas, we need
Yeah.
our uncles and our brothers, and we need you to be in optimal health. So you matter. Take the time.
You do. And we're here to encourage you. We're here to just say we appreciate all that you do, man. You run households, you take care, you carry so much on your shoulders.
Right.
And many times you don't feel like, or you think it's not important, or you don't have the time, but make the time because you matter.
Yes.
Your health matters.
Absolutely.
And we appreciate you, each and every one of you, for all that you do.
Yes.
Until next week, this has been another episode of Wellness Wednesdays with Dr. Wells and Kemille.
Thank you.
I just want to say thank you all so much again for joining us tonight, and we will talk to you later. Have a great evening. Stay safe and be well. Take care.
Bye.
Bye.